So hello, everybody. As I've been introduced by Anka, my name is Susan Munabi-Babigumera. I'm also a researcher on the GELA project, and I'm based at the Western Norway University of Applied Sciences. I've been asked to make this presentation introducing the GRADE CERQual approach. How much confidence can we place in findings from qualitative reviews? I'll be making this presentation on behalf of my colleagues, Claire Glenton and Simon Lewin. Simon sends his apologies. He's not able to join us today, but Claire is held up in another meeting and hopes to join the tail end of this session. Can you see my slides?
Yes, we can, Susan, thanks.
So I will, in this session, I hope to briefly introduce the GRADE CERQual approach. I'll use about 15 minutes to do that. Pause for a few questions that may have come up during that presentation, and then we'll spend the rest of the time in discussion about what the GRADE CERQual assessments mean. And to do that, we'll use an exercise using examples from review findings. Now, I don't know everybody on this call, so I thought we'd just start with a few questions to see who we have on this call. Please use your thumbs up function or smiley face function, or use the chat to let us know who you are on this call. First question, have you carried out a systematic review of any kind? Anka, I can't see anything on my end, so please just give me a shout. Everyone on this call, a few on this call.
I see quite a lot of thumbs up.
Perfect.
Susan.
Great. Next question. Sorry. Have you been involved in a guideline process?
Okay, some thumbs up.
Some thumbs up. Great. Are you familiar with the GRADE approach? Maybe you've conducted a systematic review and used the GRADE approach. Maybe you've only heard about it. A thumbs up will be good. Doesn't matter if you've heard about it or used it. Let us know.
Yeah, I see a few thumbs up here as well. So
perfect. All right. So it's good that we have a few of a wide selection of groups represented in this session. Hopefully that leads to an interesting discussion, and I hope we'll all pick one thing or two from this session. And to get us started, I'll seek to answer this question: why assess confidence in qualitative evidence? Now, users of evidence, and they may be anybody, tend to make judgments about how trustworthy evidence or information is. And we all, based on our attitudes and stereotypes, have implicit biases that may drive these judgments when looking at evidence. It is therefore helpful to have a systematic and transparent way to assess confidence in evidence, particularly in guideline processes where decisions made can impact many people. And this is where the GRADE CERQual approach comes in. The GRADE CERQual approach aims to transparently assess and describe how much confidence to place in findings from qualitative evidence synthesis. The first word that you may notice that's a little different from GRADE in general is we use the term confidence, whereas GRADE uses the term certainty of evidence. So GRADE CERQual approach aims to assess how much confidence to place in findings from qualitative evidence synthesis. And GRADE is part of a range of approaches for assessing confidence in evidence that have been developed by the GRADE Working Group. It is a tool that can facilitate the use of qualitative evidence in decision-making processes. But what do we mean by the confidence in the evidence? It is the extent to which a synthesis finding reasonably represents the phenomenon of interest. In other words, that phenomenon of interest is unlikely to be substantially different from the research finding. And we use GRADE CERQual approach, which consists of 4 key criteria: the methodological limitations, coherence, adequacy of data, and relevance, to assess this confidence in the evidence. And we apply these criteria to each analytic output of a synthesis. That is, to each finding, to each theme or category, however you choose to call it. We apply these 4 criteria, and that process is what we do when we're trying to assess the confidence in the finding that describes the phenomenon or the aspect of a phenomenon. And as mentioned, there are 4 key criteria we use, but this slide is flagging a 5th criteria that is still under discussion by the GRADE CERQual working group, that focuses on dissemination bias, which is similar to publication bias when we are talking about systematic reviews of effectiveness. So this 5th criteria is still under development, but is not yet recognized as one of the 4 components that we assess when we assess our confidence in the findings. But we flag it here because maybe at some point down the pipeline, these 2 will be in use as part of the GRADE CERQual approach. But for now, we will concentrate on the 4 key elements of the GRADE CERQual approach. Yes, and to dig in a little more, I'll use a scenario. Imagine decision makers are considering to offer pregnant women group antenatal care instead of face-to-face or individual antenatal care. But before they make this change, they want to know whether women are likely to accept it. So a qualitative evidence synthesis commissioned or is carried out, and one of the findings suggests that one of the aspects women like about group antenatal care is that the other women offer them emotional, psychological, and practical support. But how confident are we or can we be in this finding? What you want to find when you're conducting this review is a group of studies that are trying to answer the same question, that are of high quality and that show a clear pattern. That is, they're all among women drawn from very different, a wide range of settings. However, you may find that in doing this review that some of the studies have not been very well done, and this may lower your confidence in the finding. And this is what we call methodological limitations and is similar to risk of bias in GRADE. You may also find that some of the studies are not answering the same question that you may be interested in or that you have asked. For instance, while you're interested in women's experiences or perspectives, some of the data may actually describe not the women themselves, but their husbands or health workers or women or other stakeholders that may not necessarily be representing, that may represent the woman's voice in the data. And you may have concerns about the relevance of the data. This is one type of relevance issue that we refer to as indirect relevance. And it is similar to indirectness domain of the GRADE, in GRADE of effectiveness reviews. Another situation tied to the relevance issue is where the data is only relevant to part of the question you are asking. For instance, while you may be interested in experiences of women around the world or from all across the world, the data may actually only represent women from some settings, or largely represent women from some settings, or underrepresent women from the setting that you're interested in. This is another type of relevance issue, and we refer to it as partial relevance. And it may lead you to have concerns about relevance of the data. That issue is tied to the fit between the data that underlies your finding and the finding itself. This is what we refer to as coherence of the finding. While some findings may more or less mirror the data that underlies them, in some situations it is unlikely. I mean, in those situations where the finding actually represents or is very closely related to the data that underlies it, you may have very few concerns or no concerns about coherence. But in the cases where you choose to emphasize some aspects of the data and pay less attention to other aspects of the data, you may have a simpler finding, which may be clearer, but it may also lead you to have some concerns about coherence. In other cases, you may choose to develop a finding that is not just describing the data that underlies it, but is interpretive. You've added a layer of interpretation to the data, or it's explanatory and it's pointing to theories or patterns in the data. This finding may actually be useful than a finding that simply describes the underlying data, but it may also lead you to have some concerns about coherence. And you may want to flag those concerns about coherence. Finally, the fourth issue that you may be concerned about is the amount of data that is supporting your review finding. You may find that the finding is supported by data from very few studies. And then you're concerned about the adequacy of the data. Or the data may actually be so thin and superficial that you cannot really explain or explore what is going on in that data. And in this situation, you also may have concerns about adequacy of the data. And this is what we often refer to as thin data. It doesn't allow you really explore what is going on in the data. And then you may have concerns about adequacy. So after going through each of these four components, you identify your concerns and note these as either no or very minor concerns, moderate or serious concerns. You do this for each finding and you make an overall assessment and indicate your confidence either as high, moderate, very low, low or very low confidence. Now, after we've done this for each finding, and a review may have any number of findings, really. Some reviews I've done, I've had close to 50 findings. A few could have 10, 15 findings, but you apply the GRADE CERQual to each individual finding. And when you've done that, you'll have a list of findings, which you then place together or try to bring together in what we call a summary of findings table. And in this slide, you see a summary of findings table. At the top is the objective of the synthesis. On the right hand or the left hand side is the review findings. That's a whole list of the findings in that review, followed by the CERQual assessment of confidence in the evidence, an explanation of the assessment and the studies that support that review finding. And this is useful to have, the studies, because then you can go back to trace the data that supports these findings in case you are interested in any of the studies. Another way we do summarize this information is in what we call that evidence profile. It's quite similar to the summary of findings in that it's tabular in form, has one column that summarizes the review findings, followed by the studies that contribute to that finding. But this table also provides additional information, a little more depth in information around the GRADE CERQual judgments. And this is where you see the concerns that have been flagged for that finding and the overall CERQual assessment in that table. And in the guideline, this information is summarized further and then used to populate what we refer to as the evidence to decision framework. These summaries will be found in the domains around acceptability, feasibility, gender equity, and human rights, plus the implementation considerations sections of the ETD framework. And you'll see also in this slide that most of the data or the findings are then summarized into more textual formats and less tabular formats. And you'll circled here on the left is the indication of the grade circling of that particular finding that is supporting the acceptability domain of the ETD framework. This particular example, I should have included a reference, is taken from the WHO guideline on digital health, evidence around digital health. So in summary, this is really a brief walk over the grade CERQual approach, the elements and what goes into those judgments and how we present them finally in the review, but also for guideline processes. I will now pause for discussion, a few minutes just to pause and reflect in case there are any questions that have come up since I started presenting this. Any questions? Any burning questions? No. Okay. Maybe we can go ahead and hopefully there'll be some questions after we've worked on the exercise and yeah, let me continue to share this. Right. What we're going to do is work on an exercise which was shared earlier by email. This exercise aims to give you an opportunity to assess and interpret the grade CERQual assessments. It's drawn from an example of a qualitative evidence synthesis on perceptions and experiences of labor companionship by Boren and colleagues. And in this review, the labor companionship is defined as the support that's provided to a woman during labor and childbirth, and which may be provided by a partner, family member, friend, douala, or healthcare professional. The objectives were to describe and explore the perceptions and experiences of women, their partners, community members, healthcare providers and administrators, and other key stakeholders regarding labor companionship. And to identify factors affecting successful implementation and sustainability of labor companionship. So what I want us to do in this exercise is to spend a few minutes, read through the summary. It's a short summary, and then look at the finding. We'll start with one finding and work through the other findings in case we have time. But please concentrate on the first finding at least. In case we run out of time, we'll just have to stop at that. But look at the first finding and the grade CERQual assessment. Try to explain why you might have less confidence in this assessment and note any questions you may have. Now, because some people may not have had time to read through it, I'm proposing we give ourselves 5 minutes, each of us reading through and noting down any questions that you may have, and then we'll come back into the discussion. So 5 minutes, let's say we'll reconvene about 4:30. Did everybody receive a copy of the exercise?
No.
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 All right.
No.
That's
Okay, I was trying. So I asked that the worksheet was circulated, but I was trying to share the file in Teams, but it doesn't seem to be working for guests. So let me quickly upload it to Google and then share a link with everybody. Give me a second. Hmm. Okay, I hope you can access it via the link in the chat.
Sanka, since many people seem not to have received this earlier, maybe we'll give it a little more time and reconvene maybe about 4:35 to allow everybody a chance to read through it.
Sounds good, Susan.
Yeah. Right. In the interest of time, we'll proceed. I hope you've had some time at least to orient yourself and read through the summary and the first finding. We'll get started. If anyone had any issues they found as they read the first finding, is there any reason you'd have less confidence in the finding after you've looked through the GRADE CERQual assessments? Please raise your hand or put your question in the chat, whichever is convenient for you. Were there any questions that arose after you read through the first finding? Maybe to get us started, the first finding was about providers, women, male partners, highlighting the physical space constraints of the labor ward as a key barrier to labor companionship. And it was perceived that privacy could be maintained and could not be maintained, and wards could become overcrowded. So for this GRADE CERQual assessment, it was assessed as moderate confidence. Do you think this was okay? Was moderate confidence what you'd have given it? Would you downgrade it for any reason or consider even upgrading it again? Is there any, did you agree with the assessments that were made? Olabisi, I see your thumb up. Can you let us know what you're thinking?
I won't downgrade. I would quite agree with this because they had adequate data. They had adequate data. I think this is quite relevant. So if I look at what they had assessed at the 4 different levels, I would still make this. They have 2 minor, 2 moderate. I will still make it a moderate. So I think I'll just go along with them.
Okay. Do everybody agree with that or have another opinion about that? There's no right or wrong answer here because it's a judgment, because based on the information you have, you could think otherwise or question why such a decision was made. So please don't hesitate to flag any questions that you may be thinking about. Question there is a hand up. Talitha, please go ahead.
All right, thank you. So I just wanted to find out, do you just make a judgment based on, because I know there's criteria there listed, but is it you just make a personal judgment to moderate or low or high confidence?
Okay, that's a good question, Talitha. For each of these criteria would have had, and we would have had the layer of data that supports that finding, right? So for this finding about the providers, women and male partners, blah, blah, finding 5, all these studies that are listed here would have had their bits of data. Whatever we extracted from that article would be under that finding, so that we can then link the data to this assessment, right? And use that basis to then make this summary. So unfortunately, this is highly summarized, so you can't go into the data to see what each of these studies said about that finding. because it's based on that data that you then decide if you have any concerns for each of these criteria. Okay, so there's a lot of underlying data that's not shown in this summary, but assume that for each of these studies, there's some data there that led us to that decision, that, you know, the data that's supporting this finding fits nicely what we've summarized here, and therefore we have minor concerns regarding coherence, for example. And then again, we do the same for relevance and look at all the data that has been extracted from these forms, from these 8 studies, and then look to see if it's adequately reflecting the finding. And from that, it's that data, I guess that's what I'm saying, it's that data that we use to base our judgment on. So it's not as if we just, you know, decide, okay, this will be minor or moderate, but we're drawing that out of the data that is extracted from those relevant studies that are supporting this finding. For methodological limitations, we actually use additional tools because you may have heard of CASP tool, for example, the critical appraisal tool, which is a tool that helps assess the study design and conduct, the methods used in that study and the conduct, if they meet, you know, the agreed upon standards for qualitative studies, for example. So we use that tool to judge the quality of those studies, and we base that then to make the judgment on either on the methodological limitations within those studies. So this summary is really highly summarized. Underlying this is a lot of data, and then a lot of discussion even within the review group, so the review team, to say, is this minor, is this major, or I mean moderate concerns. And then it's out of that process of discussion that you then make an assessment. But also another point to raise here is that when we are sitting back as review authors, this is the data we present to the guideline panels, right? As part of the information they need to make recommendations. And then there is also sometimes a kind of discussion that comes out of this process, because sometimes the panel may ask, why have you given this finding moderate confidence? We think you could downgrade it because of, you know, in our setting, maybe issues around privacy are not so important. So there's sometimes some discussion that can happen as guideline panels consider often global synthesis like this one and begin to again assess the relevance or of that finding for their setting. Yes, so there are discussions that go on, there are consensus processes before a final conclusion or agreed upon judgment is made on the confidence for that finding. Right, any other questions? Yes, Millie, I don't please, Anka, you may have to direct me whose hand was up first.
Yeah, Millie
on
is
talking
first,
without.
Susan.
Millie, okay. Go ahead, Millie.
Hi, Susan. Hi, everyone. Thanks so much for such a informative CPD session. With regard to the assessments, I mean, my experience is more in quantitative type of research. And so can we picture this to almost look like a risk of bias table that we might use? So when you apply, for example, the CASP tool, you end up with, rating your risk of bias. And if you want to think about the ranking in the different colors, like the green, red, and yellow, is that kind of how it's represented? And then, you're able to tell whether there was a very high confidence or low confidence in those results that are being presented for the individual studies.
Mm-hmm. Thanks, Millie, for that question. That's another interesting one. The methodological limitations, yes, that particular element would mirror the risk of bias assessment that we do for effectiveness studies. But the other components do not mirror the risk of bias, but they mirror the other elements of the grading the grading that we do. So the coherence, I think, is related to indirectness, to directness also. Adequacy is related. Now, I won't remember because it's been a while since I last conducted a quantitative review, but the GRADE CERQual was built or developed based on informed by the thinking of the grading for effectiveness reviews. So these elements indeed mirror the elements of the grading for effectiveness reviews. But of course, some of them don't exactly relate. So we are using, for example, not exactly the same terminologies. Certainty, instead of saying certainty of evidence, we're saying confidence in the evidence, because of course we're trying to mirror the qualitative nature of the data that we deal with. So yes, they mirror certain elements within GRADE, and methodological limitations will mirror to risk of bias assessments. There's another hand up.
Yeah, I think Ian, is it Ian? Sorry,
Ian,
Yeah,
please
thank
go
you.
ahead. Yeah.
Thank you. It's really very interesting to review this process. So when I was looking at the table, one of the things that really as a methodology is really highlights like we have reviewed here like 51 studies. And when we go with the evidence categorizations, then it's not like that all those evidence are really reflected in a good number of studies or something like that. So like how you really weighted that, which will be your demarcation to make a gradation, like, okay, we can go with like how really the thinking process goes to really weighted every aspects of this column to really make a final comment about the moderate or low or high confidence.
Thanks for that question, Ian. I think you're picking on quite a number of issues. One of the issues is that in qualitative evidence synthesis, I think it's still like effectiveness reviews. You've screened, you've identified 20 studies, but as you begin to assess the interventions or whichever the primary outcomes of interest are, not all those studies may have reported that primary outcome of interest, right? So you still will summarize those studies that contribute to that intervention, whatever it is, and that's the data you summarize in that category or in that intervention of interest, right? So this is similar here. We have 51 studies. They are all included in this review, but as we analyze them, then some findings are reported in some studies and not in others. So this particular finding that is reported here that we are discussing now, only 8 of those studies reported that finding. That's why you'll then pick 8. So, and then the issue of weighting, you're not really weighting the study, you're just looking at the data that's underlying that finding and saying, okay, the data that's in this finding, is it well aligned to the finding the way I've summarized it here? And then you say, yes, it is. I have no concerns, or I have minor concerns regarding coherence. Then for relevance, you're saying, okay, the data in this finding, do I have any concerns about the setting or the population that I am concerned with? And then you're saying, well, I have minor concerns because the finding could still be relevant for my low middle income country setting with overcrowded wards. So you're not waiting, but you're just considering, looking through the data that you have collected from these 8 studies and saying, okay, do I have any concerns that would lower my confidence in this statement that I am making about the the labor wards and privacy. The issue is is perceptions of companionship, right? So is there data that would make me is this finding the data supporting this finding giving me concerns that would make me less confident about this finding in relation to the question that I'm dealing with, which is labor companionship? Long-winded answer, but I guess I'm saying it's not about waiting, but it's just looking through your data and seeing how much data or how many concerns or if you have any concerns, what are they? And you're noting those down in a transparent way to enable someone looking at this data to see to know where those concerns are.
Thank you. Thank you for explaining it in a really very simple way, because I was really thinking in a different complex way rather than that. But it's really, really good. Thank you. Thank you for that explanation.
You're welcome. Very interesting questions for sure, and nice to go through them in that way. Any other questions before I wind up? Or we could touch on the second finding in case, because we have about 10 minutes more.
Susan, I actually have another question if there's no question from anybody else.
Yeah.
Because for the first finding, you said that relevance, you've got minor concerns because it might be more relevant in a low middle income country setting. So if you think of people, if using this in a guideline in a low and middle income country setting, that would obviously be really relevant, right? Mm-hmm. So in that case, just considering the guideline, you wouldn't have minor concerns, but that wouldn't necessarily then affect your overall confidence in the statement, right? Not sure if my question is clear, but so I'm just thinking that if you are in that setting, but you have actually said that you had minor concerns regarding relevance, but for your setting, it's really relevant. Mm. Would you, as a GDG member or part of the guideline development process, would that affect the CERQual assessment as such? Does that make sense?
Yes, it does make sense, Anka. And I think in this case, it wouldn't alter your judgment because they indicated here minor concerns. Maybe you could say this is very relevant for low and middle income country settings. So we should keep it as no to minor concern, as in they are not concerned. It's no to minor concerns for us, right? So this wouldn't change your judgment about relevance. But there are situations where the global evidence in that finding could lead you to have concerns, right? And we're seeing this where we're moving from global reviews to trying to adapt them at national or subnational level. And then sometimes the evidence that's supporting the finding, doesn't quite apply or is less relevant. I'm using the wrong term. Is less relevant for our setting, right? So sometimes we have noticed that we may have to consider our relevance and reassess our relevance element when we are moving from the global evidence to national or subnational, and that could change your overall assessment, right? In this example, maybe it won't, since the finding was highly relevant to low middle income settings. So this minor concern may not change, but in other questions, it could change in case the global evidence didn't quite, you may have concerns about relevance for your setting. I don't know if I've answered that well enough for you, Anka. Claire, I see your hand up. You may want to add to this.
Yeah, I probably just repeat what you just said, Susan, but we have a very specific example at the moment in the GERLA project. we did the review on enteral feeding, and we actually graded it twice. So we graded it once for a sort of global review, that maybe we'll publish, and we assess the relevance for, the world, as, a statement like this, is this relevant for everybody in the entire world who's going through enteral feeding? But then for the specific context of the guideline, we graded it again for the Malawi setting. And then the one thing that changed there is, of course, relevance. So you always grade in a context. And in this particular review, in the exercise, the context is a global statement. We're stating that globally, this is how women or their husbands will experience something. But if we had been grading it in the context of, for instance, use in a low and middle income country, then we would have done things differently. So yes, so this is the relevance one is the one component that changes according to context. So yeah, I don't know if that makes sense. So the grade circle assessment, you'll see if we publish the enteral feeding review, will be possibly slightly different than the grading that we've done for the Malawi setting, for the reasons that Susan described.
It's clear. Olabisi, you have your hand up.
Yes, I do. Thank you very much, Susan, and thank you for giving the clearance to say that the location sometimes matters on what we do when it comes to grading. And I'd like to say that I was actually interested in number 6. That's the concern, and that's the second outcome. And I thought when I was looking at it, I would rather downgrade that confidence from low to moderate. Looking at the fact that concerning coherence, they had minor concerns. Concerning relevance, they had moderate concerns, and adequacy was serious concern. And then concerning the methodology, they also had moderate concerns. So I thought that shouldn't end on the overall a low confidence. It should be moderate at the least, rather than low. So I would like you to just shed more light into that.
Thank you, yes, thanks for noting that. And I don't know if others had looked at this, but at this particular finding, but the finding she's pointing to is the one about some providers, women and male partners, were concerned that the presence of a labor companion may increase risk of transmitting infection in the labor room. And she noticed that there's moderate concerns for methodological limitations, minor concerns for coherence, moderate concerns for relevance, and serious concerns for adequacy. And this was particularly assessed as low confidence. But you're suggesting that it should have been moderate. But on the other hand, let me throw this to the group. Do you think it should be moderate confidence or go down actually and go to very low confidence?
Hello, I think moderate is a fine assessment.
Any other thoughts? Should we go with moderate or should we go with very low? Anyone think otherwise? Think we should go very low? Because there are serious concerns about adequacy, moderate concerns about relevance, and moderate concerns about limitations, methodological limitations.
I think I agree that it should be very low.
Yes, I think it should be very low, or it could go very low. Why? If we assume we start at high confidence for the finding, we assume we start high like we do in grade, and then we're downgrading for the concerns, right? So we had serious concerns for adequacy and moderate concerns for 2 elements. So you're going even lower. So you could argue to go very low, and because you have quite a number of concerns here. So I agree, it's probably one element that you could argue to go very low. If you're on the guideline panel, you would throw this issue back to the methodologists or the team that was developing the review and say, why have you assessed this as low confidence? Why is it not very low confidence, since we have these concerns that you have flagged here? And we as reviewers would, of course, go back to either justify why we still think it's low, or why we could have made an error, we could revise our assessment, and we could go very low. So it's good that you picked this up, Olabisi, you are correct, and we would argue to go very low, not moderate, but very low, given our concerns for this. We are running out of time, but I see, Dixon, you have a hand up. Give you a chance before we close.
Yeah, okay. Just a quick one. I was going to subscribe for it to be as very low, looking at the volumes of concerns around it. So I go with the opinion that it's very low.
We're in agreement there. So thanks, everybody. This has been great. I think I want to finish off with one slide of take-home messages before we. Yes, take-home messages. GRADE CERQual is an approach for assessing how much confidence we can place in individual findings from a systematic review of qualitative studies. This approach is intended to help decision makers to use the evidence from systematic reviews of qualitative studies in their decision-making process. GRADE CERQual involves judgments, as we have all had a chance to experience in this exercise, and there is no right answer regarding how a finding should be graded, but by being systematic and transparent, we hope to make the thinking about the judgments explicit to the user. And I hope we have convinced you about this in the session today. So thank you, everybody, for participating, but I also particularly want to thank, to acknowledge Sarah Rosenbaum, who developed these slides from which most of this presentation is drawn, and also for the GRADE CERQual approach, the GRADE CERQual project team who have developed this approach. So thank you, everybody, and thank you for participating in this discussion. I'll hand over back to you, Anka.
Yeah, thank you so much, Susan. I think this was a really great session, and I really enjoyed the discussions and the questions as well. So thank you, everybody, for participating. It was great to see so many of you on the call. We do have just a very short feedback form for you to complete, please. I posted the link in the chat, so if you can just give us your thoughts on the session and what we can improve on generally. And then also just a little save the date for the next COP meeting, which is scheduled for the 28th of May. And we'll look at including, or how to include, equity considerations. So have a look out for an email and a calendar invite and a flyer on that one. So thanks, everybody. Have a great evening, and yeah, see you next time.
Thank you.
Kanka. Bye-bye, everybody.
Bye.
Bye, everyone.
Bye.
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 Bye-bye.
Danke. Bye.
Bye.